CVS is hiring work-from-home professionals to operate as outbound call coordinators. They are going to offer a $1,000 sign-on bonus, and this is going to be a full-time position. It's going to pay about $17 to almost $28 per hour. Again, they're going to have a $1,000 sign-on bonus. Typically, guys, you can clarify with your recruiter. What they'll do with this $1,000 sign-on bonus is divide it into about three paychecks after you work about 90 days and make it through the training. So take note of that. The job description: the health advocate within the Healthy Outcomes team conducts outreaches to their Medicare members to inspire and encourage healthy behaviors through innovative, compassionate, and empathetic telephonic communications. The goal of each outreach is to ensure that every member has a clear understanding of the available benefits that are afforded to them under their Medicare plan for specific screenings and medications. The health advocate facilitates provider and member outreaches telephonically to ensure Medicare member receipt of important services to improve star health outcomes. So basically, guys, you're going to be reaching out to people that are customers of CVS, kind of explain to them what their benefits are, answer any questions they have. And the neat thing about this job, you're going to be working with providers and members as well. If you're working directly with providers, that is going to be a very smart career move. You're probably going to be able to make some serious money down the line. Maybe you could go into physician recruiting, pharmaceutical sales. Anyway, you can really take that a lot of different places. The health advocate provides support for healthcare effectiveness data and information set, also known as HEDIS, quality initiatives by performing the following: outreach to members who don't have a record of the designated services, vaccination or medication refill, effective capture of barriers and data collection, use of motivational interviewing skills to provide solutions to meet the gap in care, and providing best-in-class support to each member. They'd like you to ensure that every customer is treated professionally with respect and all questions are thoroughly answered and or triaged and responded to. So if you can't find the answer to a question, go ahead, find out the answer from someone else or direct the customer somewhere else. They'd like you to act as an advocate for the Medicare members' preventative health and vaccination needs. They'd like you to collect effective data elements in the CRM to support medical record chasing for HEDIS, medical record documentation, and services. They'd also like you to provide members with the right information at the right time to help them make better decisions about their health and health care, increase member satisfaction, retention, and growth by effectively delivering competitive services to members and providers through a fully integrated organization staffed by knowledgeable, customer-focused professionals supported by exemplary technologies and processes. All right, and they have a few other things here, guys, as far as their requirements go. There's a pretty long list here, so I'll let you guys read through that. Again, the pay range and benefits, guys, we'll probably hit the benefits after this. The pay range is going to be $17 to $27 per hour and 90 cents. Please keep in mind that this range represents the pay range for all positions and the job grade within this position falls. The actual salary offer will take into account a wide range of factors, including location. So most likely, guys, you're going to probably start at $17 per hour. If you have more experience, live in a different location, you'll go higher. But pretty much for this job, guys, they have what's called salary bands. And so for this job, they have, right, this is going to be the outbound call coordinator. They'll probably have a certain band that starts at 17 and goes up to 27.8 so that they can give you promotions and raises and stay within that range. So eventually you could probably work yourself up to $28 per hour if you stay in this position, get good grades on your, get good feedback on your yearly reviews, etc. Required qualifications: they'd like you to have Windows-based application knowledge with the ability to use standard corporate software packages and corporate applications with a high degree of computer literacy. So basically, if you worked a customer service job before, guys, you're basically going to be using their software. You can just kind of put that as your experience. They'd like you to have effective communication skills and experience speaking with medical providers and or clinical staff. They'd like you to have strong listening and interpersonal skills, skilled at developing and maintaining effective working relationships. They'd like you to have strong analytical skills, focusing on accuracy and attention to detail, demonstrated ability to de-escalate situations, empathy, compassion skills, and listening skills. We will make a guess here. They're going to ask you a question about this in the interview. They'll probably say something, tell us about a time where you de-escalated a situation with the customer. I almost guarantee that they will ask you that. If you get an interview for this job and they do ask you that, come back to this video, let us know in the comments so we can see if we were right. Okay, the ability to apply creative thinking skills when needed to solve members' concerns or have a desire to advocate for them. The ability to thrive and adapt. The ability to work independently. Guys, you're going to be working remote, so if you just have examples where you kind of manage yourself and don't need a manager to tell you what to do next, that's going to be very big here. And they have a few other things as far as this goes. If you're bilingual, guys, that's going to be a big plus for them. It says bachelor's degree. I don't think they really care that much about that. If you're bilingual, I bet you that you'll hit above $17 per hour, and that'll almost be a guaranteed shoo-in for that. If you have medical certification, if you have your CN or LPN, medical assistant, etc., that's going to be big for you as well. Prior experience working directly with members and consumers, preferably in a call center setting. They'd like you to have 3 years of recent experience and related experience with healthcare marketing, outreach, etc. And as far as that goes, 3 to 5 years of experience in a healthcare setting. Pretty much just repeated the same thing there. And so definitely, guys, remember this. We say this all the time. The requirements that are on the job description are going to be a wish list of what the manager has. So definitely still apply to this if you're pretty close. For example, it says 3 years of recent and related experience within healthcare. Typically, they're going to be hiring mass amounts of people for this job, guys. There are definitely a lot of open roles. So the chances of them finding a bunch of people with 3 years of recent experience specifically within healthcare marketing, etc., are probably pretty low. So make sure that you don't reject yourself. Let them reject you. Don't do their job for them. Education, we can see just a high school diploma or GED. And as far as benefits go, guys, CVS is definitely going to offer you healthcare. They're going to offer you stock options. They're going to offer you a 401k with a match as well. Give us a thumbs up if you like this job posting. And if you didn't, go ahead and check out this latest job posting that we just listed.